If you've been following the news lately, you might have seen a lot of people talking about the Affordable Care Act enhanced premium tax credits. That's because these credits, which help keep healthcare costs down for millions of Americans, are about to expire at the end of this year. Let me tell you a little bit about what these credits are, why you should care, and what could happen if Republicans allow them to expire at the end of the year. When you search for healthcare coverage through the ACA marketplace on healthcare.gov, the rates you see are discounted thanks to these tax credits. These tax credits work by lowering people's premiums, what you pay for healthcare coverage. They don't go to the wealthy or corporations. They go to everyday working people, many of whom literally wouldn't be able to afford healthcare without them. If the tax credits expire at the end of the year, the costs of premiums will explode. In fact, experts expect to see the largest premium increases in nearly a decade in healthcare costs. That huge cost increase would come at a time when the cost of living is already too high, and it would disproportionately hurt Americans who are older, who are working, who are self-employed, and those living in rural areas. Now, the good news is that we can still prevent these tax credits from expiring. I've introduced legislation that would permanently extend these credits and prevent healthcare costs from climbing even higher and squeezing working Americans already facing a cost of living crisis. But this year, my Republican colleagues in the White House have blocked 3 attempts to pass this extension, and they're still holding it up. If Congress doesn't act, 20 million Americans are going to see their health insurance costs skyrocket, and 4 million Americans are expected to lose their coverage. And it's not just those who get their health care coverage through the Affordable Care Act who will see these costs go up. Without these tax credits, more Americans will go uninsured, and costs will go up as people without insurance are forced to seek care at emergency rooms. And here's the thing, these premium tax credits work. They've helped fuel record enrollment. They've brought quality, affordable health care within reach for millions and millions of families who otherwise wouldn't be able to afford it. For so many, they've created much needed breathing room in household budgets. To pull the rug out now would be a real catastrophe. So, as Congress discusses how to avert another government shutdown, there's a real opportunity to get this done. I sincerely hope that my Republican colleagues will come to the table so that we can work in a bipartisan way to preserve these credits, to keep costs from skyrocketing further, and to deliver lasting relief for everyday families.